This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D.HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
You know, what a difference a week makes. Last week at this time, we were like, oh, first day of spring. And here today, winter returns. I mean, if you're going out, you better bundle up because it is winter. They're talking about temperatures that we're supposed to have in February. All right, well, eventually we'll straighten it out, like by Thursday or something like that. Good to have you with us as always. It's Health Watch, Sundays, 8 till 9, the live version here on Talk Radio 1210 WPHT. As always, we talk about the who, what, when, where, why, and how of what Innovative Medical Associates does. And we do that with Dr. Molly Fantasia, the PhD doctor, and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We call this our mission statement, and we explain, or Dr. Molly explains, I should say, throughout the course of the show, how what she does can potentially help you and anyone you know improve your quality of life. And again, that is the mission statement. So stick around. And of course, during the course of the show, if you have a question or a medical challenge or anything you want to run by Dr. Molly, maybe you have a friend. A lot of times people call in and say, I have a friend. If that's the case, call in 855-839-1210, 855-839-1210. That's the number. And again, Health Watch, Sundays, 8 till 9, right here, Talk Radio 1210 WPHT. Innovative Medical Associates, Dr. Molly, is unique.
Oh, it's very unique.
I mean, unique should be in capitals, right?
Yeah, I mean, maybe we have to change the slogan. We say innovative medicine starts here, but maybe what we have to do is change that to unique medicine starts here as well.
And it truly is.
It does, yes.
Talk about what you do.
Sure.
How and why it's unique.
Okay. Well, it's easy, John. First of all, we are a cooperative of healthcare providers who share a similar type of philosophy in that, obviously, we do primary care, but we know that people are, in our opinion, heavily medicated many times when they don't need to be. So what we like to do is, obviously, if you come in with a problem and you need an antibiotic, you're going to get it. Just had a case this week of a gentleman who's a retired colonel, 90 years old, and no one ran a urinalysis. His primary doc didn't run a urinalysis. He was having some problems, having fevers in and out. And so, simple thing, we ran a urinalysis. We found out he has an infection. And guess what? Guess what the fine doctors ordered? An antibiotic.
I was just going to say that,
But in addition to that, we actually addressed some of his urination problems by giving him natural type substances like vitamins, minerals, amino acids, and we delivered them by hydration.
People always ask me, and I've mentioned this on the show, well, what do you go twice a week? And what do you get? I said, well, it's vitamin C and other things. Well, what does it do? What is it?
Well, that's easy.
What does it do?
That's easy. You know, we know that if you look around today in today's market, you see nothing but ads today, either for pharmaceutical conditions, right? Here you got to take all these new pharmaceuticals, and in the same breath, many times we now see, oh, you can use these wonderful vitamins that will help your problem. And believe it or not, they're right. It will help your problem, but not unless it gets to a therapeutic dose. And we found that the best way to deliver a therapeutic dose is through hydration.
And that's really your cornerstone, hydration.
That's it in a nutshell.
And that's what you receive when you become a patient at Innovative Medical.
Absolutely.
You receive hydration.
For the most part,
right.
That's exactly right. That doesn't mean you're going to be tied to a bag, an intravenous bag, for the rest of your treatment protocol. But in order for us to really effectuate the change, we've got to deliver a therapeutic dose, because you know as well as I know, many times you go into the health food store, you see racks and racks of vitamins, minerals, natural substances. Well, which one do you get? It's the luck of the draw, right? If you got a very good health food store proprietor who knows his stuff or her stuff, they'll send you in the right direction. But you have to take enough of it. Even if you get the best, you got to take enough of it that it can effectuate the change and improve your quality of life.
Explain, and you've done this before, when you say what we deliver, Innovative Medical, is the ocean, and what you're getting in a health food store maybe is a drop of the ocean.
Right,
so
that's exactly
can
right.
you kind of...
Well, sure, because we can deliver a dose that's appropriate for a person, for a particular patient, and also a dose that's appropriate for the reason why the patient came to us in the first place. There's the answer. In other words, it's unique in that the preparation of the vitamins, minerals, and amino acids are unique to that patient as well.
The other question that you get, and I get all the time, people say to me, you go there twice a week. Does that work? I said, well, I'll tell you what, I don't get colds. I don't really get sick. I'm going to knock on wood again.
Yeah, of course.
But I said, something's working.
John, let's really look at that. You came to me with some challenges.
Multiple.
Right. And that's a good example of why utilizing the hydration can help you. And they not only help the acute challenges, but they manage to keep your immune system in tip-top shape so that you could put off any of the other challenges, including COVID, by
exactly.
the way. So, I mean, these are the things we want to look at. It always goes back to the quality of life issues, John. We can have problems, and most of us, after a certain age, you and I are contemporaries, right?
Yes.
You don't live this long without having some
right.
kind of trouble, right?
That's
I mean,
right.
come on, it finds you.
That's exactly right.
I mean, and again, I discussed the difference between longevity and anti-aging. The point is, we can have a long life and still have a component of that life having high quality life, and that's what we're all about.
What can people expect? And I know you get this in every initial consultation. They think maybe they have to go on forever. Basically, I still go, but that's my situation.
Of course.
But you can go for, 10 weeks, 12 weeks?
15 weeks, right? Usually a course of treatment is somewhere between 10 and 15 weeks, depending on the seriousness of the challenge and where you are in that continuum. Listen, people come to me when they've been diagnosed with cancer for 5 years, and now they're in their 5th year, and now it's stage 4, and they would like to be like they were in stage 1. Well, I'm going to tell you a secret. Sometimes we get them there, but it takes some doing. This isn't holy water. You hear me say it. This is not a quick fix, but people then go on for a maintenance program, and that's really the best way to do this. So after we get you to the reserve, we want to keep you at a reserve.
How often have you said when you're in an initial consultation or even later when they become a patient, how often have you said, gee, I wish you would have come to me earlier?
Many times. And not just I say it, my docs say it. Many times. Can you imagine how much further people would be if they came to us a little earlier? Especially today, with all the new developments that are out there for the chronic conditions, including cancer. Isn't it wonderful to be able to say that our patients are doing well through those treatments, their conventional treatments, and they may be around long enough to even have the new breakthroughs that are coming through?
You mentioned COVID, and I was thinking, fortunately, again, knock on wood, I never came close to it, I don't think. But most of your patients were pretty good. I mean,
exactly. And even the one that was pretty bad got through it okay. And I think, thank God for the traditional treatment that he got right away, because we sent him to the hospital. He couldn't get an appointment with his primary care doctor. We did. We got him an x-ray and knew that he had a COVID pattern. And guess what? He's walking around great, also because of some other things we did, which we can talk about.
Speaking of things we're going to talk about, and we'll talk about it later on, so we want you to stay tuned for this. Talking about the question of, does this work? Does the hydration therapies work? You're going to talk about later on one of your docs. Who was spending the weekend painting cabinets.
That's right.
Which before... I said to you, I said, she looks like, this was before, I said, she looks like The Walking Dead.
I was pretty sure that I was going to have to get a new doc.
Yes.
Okay.
Yeah. So, I mean, this has a variety of things that we talk about.
Implications,
right.
Right.
And you've had, literally hundreds of different challenges for patients.
Sure.
And the biggest one being, I'm assuming, cancer.
Exactly.
And you've had a lot of
positive results.
Right, positive results.
John, cure is not something I talk about.
Right.
We don't cure. But I'll tell you what, we can improve your quality of life and do. And lots of my patients can attest to that.
You said something before the show when we were talking, and you said hope and faith.
Hope and faith.
And that's significant.
Hope, do you know what? I've decided that hope and faith is a modality. It's a medical modality. If you don't come in, if you can't find joy in life, if you can't find hope in life, if you don't have faith in life, in the life force, doesn't matter where you go.
We are coming up on our first break of the morning. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We're talking about a lot of things, but later on after the break, we're going to be talking about some cases. And speaking of hope and faith, we're going to delve into that. 855-839-1210 is the number here in the studio, 855-839-1210. You have a medical challenge or a question for Dr. Molly, this is a good time to call. 855-839-1210. With Dr. Molly, I'm your host, John DeMasi. We both return. More Health Watch after these words. And we're back here on Health Watch. Don't forget, operators standing by, as they always are when we're on the program here, at 856-489-0505. That's the number for Innovative Medical Associates, and that's the number you can call now if you want to get more information or you want to set up the initial consultation with Dr. Molly. 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. John is in Mount Laurel. John, good morning. You're on Health Watch with Dr. Molly.
Hey, John.
Good morning, John. Good morning, Dr. Molly.
Hey, it's our John. It's our John.
Yeah.
I have two wonderful Johns. Go ahead.
Yeah, I had I have this problem with this acid reflux that's really acting up now.
Yes, I hear.
I run into an old customer of mine yesterday, and come to find out he had acid reflux, and to the point where they wanted to take out his esophagus. Which I can't understand. But anyway, his wife said to the doctor, does he have cancer? And he said, not yet. He had some precancer cells there.
Right.
So somehow she found this doctor over in Philadelphia. There's supposed to be one of 7 doctors. I don't know if you know anything about this, where they go in and they take out the precancer cells. He said they cleaned them up.
Right. Well,
yes,
I know the program. Sure, yeah, they clean them up. I mean, look, you know what, John? You're talking about mucous membrane type things, right? You know, the esophagus is highly mucoid, and it's very similar to the kind of thing that they do for the colonoscopy when they go in for the precancer polyps, right? You know,
right.
So they cleaned him up. That's probably right. They cleaned him up in the moment. That doesn't mean that they won't redevelop. And you know what, John? A guy like him ought to be on a totally different type of track. Even if they clean it up, this is a good area to think about integrative medicine, because once they clean it up, we would like to keep it that way, right? Keep it that way.
Yeah, he says he goes yearly, and he said last time he was there, the doctor says he's like a young man. So whatever that. I mean, how he knows that, I don't know.
Well, I'll tell you what. I'll tell you what, John.
I've heard that
I don't think that particular procedure is without risk. It's like everything else. But I would tell you, he still should be looking at things that can help put his body in an anti-cancer type of system. I mean, bottom line is, I would venture to say it'd be interesting to see his report. I'm very interested in that. And the procedure's been around. It hasn't been around that long, but it has been around. So, you know, it's something to look at.
I know you can't say too much right now on the radio, but I'd like to talk to you, too, about it when I come in next week.
You bet. You know I'll make time for that. Sure. Look,
you always do. You make time for everybody in that office.
Thank you. I
really
definitely
do.
will. And listen, if you want to do a consult with whomever, we'll get you over there, and we'll try to get you in as quick as possible too. But you want to, you want to weigh your options.
When they start going down your throat and snipping stuff, man, I don't know about that.
I love you,
Yeah.
John.
I'm up there pretty good, and I like to stay away from these doctors if I can.
Yeah.
You're the best, John. But let's talk about it. Yeah, this is a great call,
John, thanks for the call.
Thank you.
And good luck with everything.
You
Thank
see
you.
how intelligent my patients are?
Yeah.
They take everything in, and then they want to research it. I love that.
He said he's up there, and we know.
Well, he's a great guy. He's up there, but I'll tell you what, he's young in his mind.
That's right.
You know?
That's right.
He knows joy.
855-839-1210 is our number here in the studio, 855-839-1210. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We were talking earlier, Dr. Molly, and I know you wanted to really bring this up. We were mentioning hope and faith.
Yes.
And this relates to a consult you had. And
yes,
it was a fairly good consult from what you told me. And then something went a little awry.
Well,
so let's talk about that.
It's a very interesting thing. When people come in from the consult, I want to say this. I get as much out of the consult, I hope, as I give the patient, because it gives me an overview of what's going on. Many times people come in and they're looking for the diagnosis. First of all, I don't diagnose. But, even my docs sometimes can't diagnose because you may have combination types of symptoms, and it could be one of many things. It could be a virus, it could be autoimmune, it could be something else. So the idea is get as much information from the patient, which gives me an indication of where I start. Well, this wasn't interesting because the young woman came in, and she actually was referred, by the way, from another patient who was in her church. And she gave me a list of all of her challenges and whatever. She was there with her mom. And by the time I was done, I sort of had an understanding of what I should tackle first. So I outlined my treatment plan. I explained you would come back in, you'd get a first treatment. In other words, you would get an IV the first time you're back. But at the same time, simultaneously, I'd be drawing blood for in the same, let's say, insert, which means you don't have to have a phlebotomy twice while you're there, just the once.
Right.
And I would give you some high-dose vitamin C, some high antioxidants, things like that. And the reason why I knew what I would give her on the first trip was she told me how many digestive problems she was having. So right there, it doesn't matter how many nutraceuticals she's taking, it's not going to give her enough reserve to even feel a little better. And I knew I could resolve that during the first treatment, at least temporarily. That's all. Anyway, get a call back from her wonderful husband, who obviously cares about her. And he said, listen, I really don't like the idea you're going to give her a first treatment. You don't know what you're giving her because you don't have the blood work back. I said, young man, I do know what I was going to give her based on the symptomatology. Well, you don't have a diagnosis. I said, well, how many physicians did you go to? How many clinics did you go to? Many. And did they give you a diagnosis? No. I said, did they ask about helping with the symptoms? Yes, they want to put her on antidepressants and anti-anxieties. I said, well, that's probably a good start, and I won't presume to know what my docs would prescribe, but it sounds like it's something. But, wouldn't it be nice to get her energy level up, to feel a little better, and maybe to really look at her symptoms and maybe address each and every one as we go along during the 10 weeks, coming in once a week? He said, great, give us the blood script and I'll get it done at the primary. I said, nope, don't do it that way. First of all, I'm not putting my medical directors in competition with your primary. They don't usually like it. And having a medical director who's a primary care physician, I know that.
You know they don't like it, right?
Right. And why would I do that? And I'm going to ask for a whole lot of tests that I'm sure your primary care doctor didn't do. So I wish them well. I told them that I wish them well in their healing journey, and I understood. But, John, it brought up for me about faith and about hope.
Yes.
Listen, I can't put faith and hope in the bag. I can't do that. what I can do is let you come into the clinic, look around, see other people. They will happily tell you their story.
That's right.
And you know what, John? I can't take the mind of all the patients I have coming through the place. It's impossible. It's impossible. And you know, the great physician is the good Lord. He's there, and I'm telling you that there is hope. There is always hope, no matter how dire your circumstances.
And I've said to you many times, I said, it doesn't matter, how many degrees you have. If people don't believe in what you do,
you can't help them.
You can't help them because no matter what you do, they're not going to believe.
And what I believe in is God's ingredients all the way. And I also know that qualitative data is so important in that initial consultation because it outlines exactly where I'm going in the beginning of the treatment protocol before I have the facts, as they say, because there's a lot more to what we do than just the facts. It's how you feel. Are you going out to your job? Do you feel hopeful? Are you able to live a more quality life?
Interesting. We've often talked about results, and we try to give the audience here on the show a picture of somebody who came in dire straits,
right,
and walks out in good shape. And we just talked about your Dr. Pat.
That's right.
I mean, she looked so bad. I was thinking I was going to tell her, listen, you can't do doctoring anymore. Why don't you go apply for the Walking Dead TV show?
God
be an extra. I mean, that's what she looked like.
Well, she looked pretty bad.
Right. So now she's painting cabinets. So what's that tell you?
Well, I can tell you that she had faith in what we did.
Right.
And she said, Dr. Molly, I am a believer in this kind of medicine. And she said, look at me. It took 30 years in traditional anesthesia for me to come around and say, guess what? This has some real merit.
Absolutely.
And I said, hey, there's nothing like the proof you get it yourself. That's all I can say.
We are coming up on the halfway point of the show, which means we have plenty of time to take your calls. And every week we get into the same situation. People call. We actually had someone call a couple of weeks ago at 9:02. I mean, we weren't on the air then. So you can call now. We have plenty of time. 855-839-1210, 855-839-1210. It's Health Watch, Sundays 8 till 9, the live version here on Talk Radio 1210 WPHT. With Dr. Molly Fantasia, I'm John DeMasi. We both return. More Health Watch after these words. Back here on Health Watch, operators standing by right now, and they'll be there well after we leave you at 9 o'clock this morning at Innovative Medical Associates. 856-489-0505. 856-489-0505. That is the number. Innovative Medical Associates, Marlton, New Jersey. And if you call today, great. If you don't call till tomorrow, well, that's the same number, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that website as well. Our show is Health Watch, our live version here, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. We're going to talk to Joe in Germantown. Joe, good morning. You're on Health Watch with Dr. Molly.
Hi, Joe.
Good morning, Dr. Molly. Good morning, John. How y'all doing this morning?
Good, Joe. How about yourself?
Not too bad. I talked to y'all a while back, and I'm a faithful listener every weekend, Dr. Molly and John.
You're a great guy. Go ahead.
Thanks, Doctor. I appreciate that. I know you and John probably heard over the news this past week that President Biden's press secretary Jen Psaki, she tested positive for COVID for the second time.
Right.
Now you know this woman. She works for the president. Now you know she has got the boosters.
Yes,
she has got all her shots, and yet she still came down with it. And I bring this up to y'all to say this. On the local radio station here in Philadelphia, I've been kind of like mocked by some of the hosts because I told them, I said, I'm not taking the vaccine. I said, now, for those that do, that's a choice. I said, but I must be doing something right. And he had trained doctors on this show, Dr. Molly and John, that pretty much laughed me off the radio because I said to myself, I've been taking ivermectin, elderberry, zinc. And I said, and here's the thing, John and Dr. Molly, I'm not bragging. I've been tested I've been tested for the COVID thing 3 times, and all
God
3
bless
times
you.
it came back negative.
God bless
so
you.
I must be doing something right. But yet I know friends of mine, and I say this, Dr. Molly and John, with all due candor, I know friends of mine that have got all the vaccinations, got all the shots, and they still came down sick. And unfortunately, and as I said, it's unfortunate, some of them have passed away.
Oh, I'm sorry to hear that.
I must be doing something right.
Well,
The point I'm saying, Dr. Molly and John, is that this government is not being honest with the people of this vaccination. If they would just come out there and say, well, look, we think the vaccination can help you, but it's not. But it may have some side effects. It's not 100% foolproof. But they keep putting up this line out there that this vaccination, and you notice the narrative is constantly changing. You don't have to after you get this booster. It'll be enough. After you get this shot, and you got people like Johnson who if they can't even produce the talcum powder without killing people, why would I trust them with the vaccine? I mean, this stuff is so when you stop to think about it, it's so insane. And all I'm saying, Dr. Molly and John, I do believe in my heart. That's why I love y'all. I believe if this country, if this government was honest and would just listen to people like you, Dr. Molly and John, and put people on natural remedies, I believe a lot of these deaths in this country could have been avoided.
Hey, Joe.
Joe.
Keep up the good work.
God
Keep
bless
up the
you,
good
Joe.
work.
God bless you. And you know God's in charge. God bless you, Joe.
And thanks a lot for the call and a bit of comedy here on the show.
This was a great call, Joe. A great call. God bless you. God bless you.
We have George in Mount Laurel, New Jersey. George, good morning. You're on Health Watch with Dr. Molly.
Hey.
Good morning.
Hi. How are you, sir?
My son is about 43.
Yes.
He had COVID early December.
Yes.
And he took a lot of high doses of vitamin D3. Mm-hmm. But right now, since then, he's having tachycardia. Mm-hmm. And he don't want to stay on medications for it. As soon as he moves around, his heart is racing. And he did want to call. I thought I'm going to call and see.
Thank you.
Is there anything you can do for him?
Yes, that's a great call, okay, because, it's very interesting. We don't know all the side effects from this COVID, even right now, even so far after what we've been through. Now, did your son have the vaccine? Just curious now.
No.
Did he? No. Okay. Well, let me tell you, let me put it this way. My doctors treat many folks post-COVID, and I have a post-COVID protocol that I developed. It does include the vitamin D. I'll tell you, I would love to run his testosterone levels. I would love to run his vitamin D levels. I would want to run his zinc levels. I would also put him on several hydration protocols, and I think we could help him. As far as there would be a specific amino acid that I would want to give him, and I would want to make sure that his cardiac functions were okay, and that this just wasn't a side effect from something else. But I would venture to say it's definitely a post-COVID side effect. We've seen it. Okay, George?
He went through a lot of stress and heart tests and everything else. And there's nothing they can do. They put him on metoprolol, but he's not happy with that. And it helped to slow it down a little bit, but he still had the symptoms.
Is his blood pressure, if for them to put you on metoprolol, was his blood pressure high?
I am not sure. I don't think so, but I'm not sure.
Okay. Well, that is one of the conventional treatments. And, I would love you guys to come in for a visit. You're not that far away. Come on in.
Yeah, George, feel free to, and thanks for the call, George. Thank you.
You know what, John, I don't want to get off on the COVID again, but that's a great call because, I'm treating several folks with post-COVID, some bad, including the gentleman I was telling you about that we hit with the progenitor cells. And he went to his pulmonologist this week, and his pulmonologist said he can't believe the change in his lung function. And yet, so he's breathing easier, he's off the oxygen, and yet he still has a drop in his oxygen when he's exerting himself. So he's got to go into exercise very slowly, and we're working with him. And I'll tell you what, he has a drop in his testosterone levels. This is something nobody's talking about.
Well, you could probably, you've written a couple of books, but you could write a book on just cases alone, and it would be a volume.
Well, there's a lot to be said for the post-COVID and the long hauler syndrome. And I would say most people with that tend to be treated at least with some integrative medicine, meaning vitamins, minerals, aminos, because that really seems to be helping them more than the conventional meds.
All right, 855-839-1210. That's our number here in the studio, 855-839-1210. It is Health Watch, Sundays 8 till 9 right here, Talk Radio 1210 WPHT. We want to talk about, and this relates to a patient that came to you with stage 4 pancreatic cancer.
Right.
And she did a test, and I know you wanted to talk about this and about genes and what this all means.
Right. Let me tell you, this patient of mine, and by the way, she's doing okay. She could be doing better. But here's the thing. I think people don't understand these genetic testing. You can do 23andMe and all of these home tests. There's a lot of them, and they're good. They're good for what they do. But you don't inherit a disease. People don't inherit the disease. What you inherit is the risk for the disease. You see the difference?
Yes.
Which tells you what? Gene expression doesn't have to happen. So she went ahead, she had a test, she said, I tested negative. Why did I have this problem? Because the test that she did really wasn't specific enough. So they didn't run enough of the genes. You realize if you were to look at DNA and spread it out in a room where you couldn't, it would be like 6,000 feet long.
Jeez,
in the body.
That's a pretty big room.
Right. At least about. I'm not saying right on. Please, all the biochemists out there, don't beat me up. I'm trying to make this, as somebody wrote a book, Genes for Dummies, okay? This is the thing. I want all people to think about our genes. Our genes do what? Our genes are usually a tight process that's always going on. And for the most part, it keeps us well. Right? It works our immune system. Some things turn on, some things turn off, which is why Dr. Molly's always talking about the Goldilocks theory. You want things to be just right so that the processes are just right. So one of the things I said to her was, do you think you just developed cancer when you walked in to see me? And she said, well, yeah, just a few months before I was only a stage 3. I said, no, this process has been going on for a long time. It doesn't happen overnight. But there are so many things that can impact gene changes. And this is what we talk to you about all the time. And if we impact your gene changes, what do? We could increase or decrease your level of risk. Does this make any sense, John? I'm trying to really reach
it does make
people
sense,
with this. So the gene mutations that happen can be mitigated. How do we do this? Epigenetics. Environment can help trigger this. Food can help trigger this. Bad lifestyle, drinking can help do this. Bad food. Look around, folks. All of those things have an effect on your gene pool. So it isn't something that you can just go out, you test, this is what's going to happen to you. No, not at all. Not at all. Just because you have a particular segment of your genes that come up with some variation or dysregulation doesn't mean you have to express the disease.
And with that, we take our final break of the morning here. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. We still have a couple of minutes left of the show, which means you can still jump in with a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. More Health Watch after these words. And of course, you're listening to Health Watch, and operators are standing by right now at Innovative Medical Associates, and they'll be happy to talk to you. If you are a little bashful to come on the radio, you want to talk to the operators, you want to get more information. And if you want to sit down with Dr. Molly, the initial consultation is complimentary, and that's really where you get a lot of information and you learn a lot about what this process is all about. Call them at 856-489-0505. That's 856-489-0505. Feel free to call, and you can call after 9 o'clock because they don't go home when we go home. They stay right there. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Don't forget, if you miss any of this morning's show, we have our Health Watch replay this afternoon from 4 until 5. So today's show, this morning's show, this afternoon from 4 till 5. Here on Talk Radio 1210 WPHT. Dr. Molly, we often talk about patients because we want the audience to understand what you're faced with many times when a patient comes in and starts your treatments.
Right.
And we like to talk about the process and the end result.
Sure.
This is a dementia patient I know you wanted to talk about.
Right. Actually was referred to us from a chiropractor who was a friend of theirs as well as their physician. And he actually became a patient of ours as well. And this patient has been nonverbal for quite a while. And what happened is we're using the regenerative medicine progenitor cells for her, and it was a very interesting case. So that includes some neuronutrition as well as these cells, and we delivered them through the hydration. And interestingly enough, she started the night she had them. He said she went home. It's very important that you rest when you get this particular treatment. She went home. She had a great night's sleep. He said the following day she was a little bit verbal. She just talked to him. She wasn't reciting Shakespeare or anything, but she definitely was making a sentence or two and actually had some dialogue with him and his sister, who's one of her caregivers. What I found interesting is she came back in for her follow-up treatment 2 days later, which is exactly the process. And she said to me, after the lovely Linda had taken her and was ready to insert her particular IV, she said, "Oh, I like your jacket."
How about that?
I said, "Oh, yeah." And I thought, well, you're a very beautiful woman, and she did give me a smile. So this kind of thing can help people with some neurodegenerative. It's a new kind of thing. And if you think about my Dr. Pat, that is a neurodegenerative disease, MS. Now, Dr. Pat's much younger than this woman. Different disease process going on. Plus, Dr. Pat changed her complete diet. She followed nothing but antioxidants, those kinds of things. And she's very dedicated to her health in terms of making sure she's in our chair every week as well. So there's something to be said for regenerative medicine. And that's something, it's a nuance. You really got to do it right. And I know there are a million places saying that they're doing it. But doing it with the patient's best interest in your mind at all times, the protocol in your mind at all times, I think we're going to outshine them.
What's different from what you do as opposed to maybe from what you hear of what other places
First
are doing?
of all, the cost is insanely different. And it's unconscionable, some of the costs. And the other
you're on the low end is what you're saying. Yeah, okay.
Right. I mean, some of this stuff is really look, nobody's going to accuse us of gouging patients, right, John? Don't do it.
No,
don't
I know
do
you don't.
it, and I won't take your money if I don't think we can help you. But this case, I think the follow-up is extremely important. The follow-up using the neuronutrition is equally as important, because when you put these cells in, they're the seeds. We have to water and feed the seeds. And I think that is a hugely different approach than a lot of other places.
It's a lot like springtime. People put grass seed on their
That's
lawn,
right,
right?
but they don't get the grass,
Right.
right? Well, maybe the soil isn't just enough, nutritious enough. And that's really a difference, John.
Are you seeing more and more of this kind of therapy for a variety of situations?
Short answer is yes. We've known for a long time direct injection like PRP into joints has been helping. But the delivery through hydration has been totally different. And, of course, it's really a research item right now, and it is, because you can't guarantee anything. But I will tell you something. It does my heart good when I see someone's partner where he said, I had a conversation with her yesterday. That's a big deal to me.
Sure, because that was non-existent before.
Right. Now, I don't know what's going to happen. I don't know. That's in God's hands. But I do know that if we can give people quality of life, and that's all we ever say, we will improve your quality of life. And that's it, John.
And how long can you expect? In other words, in this particular case, this patient, you had a couple of treatments and you saw progress.
Right.
Now, does she go on?
Yes. I would say she's going to need neuronutrition all the time at this point. It's interesting. I do believe she has a component of environmental problem. She was exposed to some heavy metals in her youth. This is the other thing. There are so many contributing factors to disease state, and that's some of the things you got to get to in order to improve quality of life. Heavy metals are one of them.
You know, I've told you many times, when I don't come in, if I'm on vacation, I don't come in for a week or so, I feel it. Like think
about just flying around and getting the recirculating air.
Right.
You don't think you're exposed to something there?
Absolutely.
I don't care, masks or no masks.
That's right.
Right? I mean, come on. This is what I mean. So there are so many issues. It's not just a question of, hey, my genes say I'm going to have dementia. No, okay, that's what I'm trying to say. You could have dementia because the exposures have caused those genes to dysregulate.
Well, look at the clock. That's about all we have time for. It is Health Watch, of course. And if you would like to speak to the operators at Innovative Medical Associates, they're there right now. They'll be there after we leave you at 9 o'clock. They'll be there all day. And you can call today or tomorrow, 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have our Health Watch replay this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, fabulous Fran, Joanne, delightful Dee, Barbara, and our nurses, Jess and Lana, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thank you for listening. Have a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, the live version, 8 till 9, Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.